these proposals would have enormous impacts. They are, in my opinion, a thinly disguised assault on the healthcare safety net. If implemented, they would cause major disruptions to state Medicaid programs and the people and institutions that depend on them.
When Democrats and Republicans in Congress got together and told the president that his health care budget was unacceptable, he went around them and created regulations administratively that have the same effect. What these regulations will do is they'll shift the cost of public health care entirely to state and local government. And the president's proposing to save about $15 or $16 billion doing this. That's the cost of about 8 weeks in Iraq. I know how devastating this is going to be to my community, and I just couldn't, in good conscience, let that happen all over the country without trying to tell people about it myself. I tried for several months calling local reporters, and I tried calling reporters in Washington to get somebody to cover this story. I would like to come and speak to somebody tomorrow afternoon in your news department. And I realized that they weren't going to do it. In some areas of the country, this could end up causing the closures of public hospitals or severe cutbacks or even closures to ERs. I would look at New Orleans as an example of what our healthcare system might become. After Katrina, when Charity Hospital was closed down, you have a whole swath of the city that just has no access to any kind of coverage, no access to primary care, no access to behavioral health care, no access to hospitals, and those people are really suffering. And this is going to hit more than just our poor people. It will also affect the middle class. Right now, our hospitals are able to provide excellent services in many cases because the care of the uninsured is subsidized through Medicaid. If you take that away, then those of us who are insured end up paying higher and higher premiums just to keep the level of care in our own hospitals adequate. So people like you and I are going to find it harder and harder to access care even if we have insurance. The great thing about public hospitals is that they're there, and it's your community hospital. And when Katrina hit New Orleans, they weren't there to make a profit, and the people who worked at Charity Hospital stayed. They stayed through the storm, and they worked without electricity, they worked without food and water, and they took care of those people. What tends to happen with private providers is they pack up their people and they pack up their equipment and they take it to some place that's safe and dry. And then the people in that community have no place to go to get their health care. In the event of a pandemic or a terrorist attack, if there's no hospital to take people to, what do you do? If there isn't any healthcare system there, what do you do? So this isn't the time to be destroying our public health infrastructure. These regulations will affect every community in our country, and that's why it's important that you write a letter to the editor in your paper and that you call your congressman right now and tell him we need a moratorium for 1 year on all new Medicaid rules. These rules go into effect between March and May 25th, so we have very little time.